Good evening, everyone. How are we doing today? You are welcome to my channel, and we are going to be looking at how inflammation causes menstrual pain. That is how it affects your menstrual cycle. Because in the realm of wellness, the concept of fighting inflammation gets a lot of attention. And for the good reason, too much inflammation, as we know, can mess up everything in the body. And this includes the digestive system, the brain, the skin, and your different organs in the body, even your menstrual cycle as well. So inflammation, as we know, play a major role in how we feel during our menstrual cycle. Sometimes people will begin to ask how. So how does inflammation really affect the menstrual cycle, or what has it to do with your menstrual cycle? Inflammation often leads to pain, and it's a major reason why your period can be painful. So if there is no pregnancy, during your menstrual cycle, during your ovulation, when the egg has been released and this egg has not been fertilized, the progesterone, which is the female sex hormone, at this level falls down. And this inflammatory chemical that normally increases due to reduction of this progesterone have a powerful effect on the uterus, and this chemical can cause the uterus to contract, and this can reduce blood flow to the uterus. And when blood flow is reduced, this can begin to lead to painful cramps that you feel. And many people get this during their period, and the level of this chemical prostaglandin, which is released in the menstrual cycle, this fluid changes with time. So when this prostaglandin level are low, the cramps will be also less. But when it is high, so also the severity of the cramps. So what is this inflammation we are trying to say? Inflammation help our body protect itself. It's very important for our life. It's very important because it protects us from danger. It also help our immune system to recognize any kind of infection or injury. Ultimately, when they recognize it, started a kind of activities, and this help to fight against the infection. If it has to be an injury, the immune system begin an activity to help to notify the production of the white blood cell that will help in facilitating the healing process. So specifically, inflammation involves a range of physiological changes, like the pain you feel when you hit your hands or your leg on a solid surface, or sometimes redness and bruises on your body. So all the symptoms basically tell your immune system that something is up there. So when you feel that inflammation as a result of pain, as a result of bruises or redness on your body, those inflammatory response will send a signal to the immune system, and the immune system will take off from there to start the healing process. And from there, the immune system take over the repair process. So whether it is a kind of fighting the germs or closing up the wound that you have. So this is why sometimes you might have an injury today, and within the next few days or few hours, you will discover that the pain has gone down. Why? Because the immune system has started the repair process. So that is why inflammation is also good. So in other words, this inflammation is not always bad. It's good because it helps us keep us from danger. It warns us when we are in a kind of dangerous situations. You always signal to the immune system and other organs of the body to protect us. So our body naturally needs this inflammation to keep us safe. So short term of this inflammation is very good, such as acute inflammation is very crucial for a good health. So the problem is when your body is not it's not nice when your body is constantly in an inflammatory process for a long time, and this can result in a kind of chronic inflammation. So this chronic inflammation is what normally lead to issue, and this can happen for a range of factors, like when your estrogen level is low, or sometimes when you are obese, also when you are stressed, or inadequate or poor quality of sleep, poor nutrition, or maybe exposure to toxins like smoke or cigarette smoke as well. So all this, if you stay on this for a long time, and this can lead to a kind of chronic inflammation, and instead of protecting you, it started damaging the various organs of the system, and at the same time the immune system will no longer be able to carry on with the repair process because of the excess inflammation or danger, or some of those issues that it has lingered for a long time. So inflammation and your menstrual cycle, they are well linked. They are well linked because when it comes to your menstrual cycle, inflammation can wreak and havoc as well. Like, for example, inflammation can worsen the period pain. As I've mentioned above, that inflammation causes symptoms such as pain. So this helps your immune system to recognize an injury, infection, or a wound. And your body does this by producing different substances. One of these examples is prostaglandin. It's an hormone-like chemical that notify the immune system. And so in the female reproductive system, prostaglandin is also induce the uterine contraction, also known as your menstrual cramps. And so this contraction are responsible for shedding of your uterine lining, and also during your menstrual period. So now, here is where it comes. When it comes to a full cycle, if your body is in a state of inflammation for a long time, like for example, you are be stressed for a long time, you will have a higher level of this hormone. It will go high. That is this prostaglandin. And during your period, because you have stayed in this inflammatory state for a long time, during your period, it will begin to manifest as a severe menstrual cramps. Remember that normally you can have a normal menstrual cramp that does not bother you, but there are some that when it comes, you cannot be able to do anything. It distorts your daily activities that day. Why is it? Because your body has been on a constant inflammation for a long time. So it is worth noting that this prostaglandin increases during your period, even if sometimes you are not inflamed or you are not passing through any inflammation, like as I said. So it normally increases during your period, and that is why you normally feel that premenstrual syndrome. So those symptoms that you feel, those pain that tells you that it's like your menstrual cycle is approaching, or even during your period you feel those abdominal pain as well, or your pelvic pain. This due to the increase in this hormone. But if you are in a constant inflammatory state, or you are being inflamed before your menstrual cycle, the pain is going to be more severe. This is the reason why many people experience a severe pain. So this female hormone drops on the first day of your menstrual cycle. That is your progesterone. When you step into your menstrual cycle, the progesterone, which is the female sex hormone, drops, and estrogen increase, because it's the one that control the menstrual cycle. And at this time, your period starts. So this prompts the release of this prostaglandin, which trigger contracture and bleeding, a kind of a normal feature of your menstruation. So the problem now is when your body is inflamed, when you are already in a constant inflammatory condition, this can ultimately make the hormone to produce more, which will lead to painful period. Also, inflammation can also lead to some PMS symptoms, like premenstrual symptoms that you normally feel. You know, when you are approaching your menstrual cycle, you feel some symptoms. So beyond this menstrual cramp that I've explained, inflammation is also associated with this other PMS symptoms with level of inflammatory markers. These inflammatory markers, they raise the risk of this premenstrual symptoms. So many people will begin to feel symptoms like breast pain, a kind of appetite craving, unplanned weight gain, also mood swing or mood changes. Sometimes you feel pain at your back. So in order to know that this is also as a result that women that have these premenstrual symptoms have a higher level of this inflammatory markers, such as interleukin-2. And the higher the inflammatory marker in your body, the more severe the premenstrual symptoms that you also feel. Also, inflammation can also lead to a kind of flares up during your menstrual cycle. Like some people that have some condition like asthma, arthritis. So during this menstruation, during their menstrual cycle, inflammation can lead to flares up of all these symptoms. So it becomes worse at that time as well. Also, inflammation can also lead to a kind of all those pain that you feel that look like a kind of feeling pain on your joints, on your waist as well. All this as a result of a flares up of arthritis. If you are one that normally have this joint pain previously, because of this inflammatory marker, this inflammation can also trigger it and make it more worse. So the next we are going to look at how to reduce this inflammation. There are so many ways that you can reduce inflammation in your body. So because inflammation, as we know, is good. It's only when you stay on inflammatory condition for a long time that it cannot become dangerous for your body. So here are ways that you can possibly reduce inflammation. Like one, you need to stay active. If you are one that have this arthritis or joint pain as well, you need to stay active. Regular exercise can lower the risk of inflammation and other chronic conditions, and also do wonders if you have these PMS symptoms as well. So just make sure that you are active and avoid excessive exercise, because excessive exercise can also increase inflammation. So minimize stress. Try to control your stress, manage your stress as well. As you know, it is more easier than done, as we normally say. But distressing is a key to help controlling inflammation. 3, prioritize good sleep. Sleeping allows your body to rest and repair itself. And this can help to keep inflammation as well and your immune system in check. Also, quit smoking and also avoid secondhand smoke. So if you are someone that smokes cigarettes, do your best to quit. Smoking decreases your body natural production of anti-inflammatory chemicals in the body. So, and also if you don't smoke, make sure you stay away from smoker or any form of secondhand smoke. The next one is limit or avoid alcohol if possible. You know, alcohol can induce inflammation, which may explain why alcohol intake is associated with most of these PMS symptoms. So try to reduce alcohol and also limit saturated fats. All the saturated fat, they are unhealthy for your health, and so because of that, they can clog your arteries and as well reduce the flow of blood into your various system. So your inflammatory response is influenced. They can be influenced by the food you eat. So if you eat too much fatty food, which are unhealthy fat, and this can affect your blood flow as well. So make sure you avoid all those unsaturated fat, saturated fat, and go for unsaturated fat like omega-3 fatty acid. You can find this from walnut. You can find this from olive plant. You can also find it for avocado seed, like chia seed, fat seed as well. So you can even find it from tuna and micro. Make sure you are eating fish, oily fish as well. So all this added fat help to reduce your risk of inflammation and also reduce inflammatory chemicals in the body. Also, make sure you eat whole plant food or eat food in their whole form. Whole grain are very important. When you eat food in their whole form, you get more of the antioxidants which can help to reduce inflammation in the body. So you can get this antioxidants from fruits and vegetable because they reduce inflammation. Also, replace refined grain with whole grain, like I said, because whole grain, they are rich in this antioxidant. They are also rich in fiber and also have this anti-inflammatory ingredient in them. And lastly, supplement with multivitamin. It is essential that you supplement along with your diet, because though it can be difficult to get all the essential nutrients from your food. So consider taking a multivitamin like maca as well. It can help with premenstrual symptoms, and also take multivitamin that can also have anti-inflammatory properties. They are also good, like selenium, zinc, vitamin D. They are also good. Also, lastly, try to manage inflammatory condition. If you have any inflammatory diseases or disorder, work with your doctor to manage this condition for you. This may involve medication, lifestyle changes, dietary restriction, and remember that inflammation can affect the entire body, not just your reproductive system. So by managing this inflammation through these above factors that we have talked about, you will be able to make sure that you are achieving your overall health goal. So thank you everyone for joining me, and do not forget to like and subscribe to this channel as well, and turn on your notification bell to get notified when next I come online. Thank you for joining me. Have a blessed day. Bye.